Let's learn about three important genital infections today. The first one being bacterial vaginosis. If there are these two keywords in the scenario, then it's definitely bacterial vaginosis. First one, there is a vaginal discharge, and secondly, it has a characteristic offensive or fishy odor. What is bacterial vaginosis? It is an overgrowth of some normal bacteria that is already present in the vagina, and it is the most common cause of abnormal vaginal discharge. This discharge has a characteristic fishy odor and has off-white color. The pH is also raised in this disease. What are the risk factors or causes? The main three are high vaginal pH more than 4.5, douching, and having new sexual or multiple partners. Now, how you can remember them? If there is a change in the pH, it creates a chance for more bacteria to grow. Similarly, if there is vaginal douching, then the balance of the healthy and the bad bacteria gets disturbed, and having multiple new sexual partners exposes you to more bacteria or infections. There are also some associated conditions with bacterial vaginosis, that is PID, pelvic inflammatory disease, preterm delivery, rupture of membranes, and miscarriage. This means that if you have bacterial vaginosis, you are more prone to have pelvic inflammatory disease, or you can have a preterm delivery, or your membranes can rupture due to this infection, and even it can lead to a miscarriage. So through what investigations we can diagnose this? Now use common sense. What were the key points mentioned in the scenario? There were only two things. There was a fishy odor and vaginal discharge. So you can only do investigations related to these 2 points, basically. So take a vaginal swab and do gram staining of that discharge. You can do it through 3 methods: Hay-Eisen method, Nugent's criteria, or the recent one, Amsel's criteria. You should remember the key points about Amsel criteria. There should be 3 out of the 4 to show positive findings. These are homogeneous discharge, there should be a high pH more than 4.5, there should be clue cells on microscopy, also known as wet mount, and a fishy odor is produced when 10% KOH is added to the discharge sample. This is known as whiff test. The only new point to remember is the clue cells. Remaining 3 are already mentioned previously. So what are the treatment options? As it is related to bacteria, so we will give antibiotics, metronidazole and clindamycin. To remember these 2 medicines, imagine there's a board at the metro station with the written notice, keep the metro area clean. So clean is clindamycin and metro is metronidazole. And preventions include avoid douching and avoid excessive vaginal washing. You can now look at the past papers. If they have mentioned fishy odor or offensive vaginal discharge, then it's related to bacterial vaginosis. Now let's look at vulvovaginal candidiasis. In the scenario, if they mention itching, and white curdy discharge, or on vaginal examination they mention there's a soreness and redness, or there's a history of OCPs, using oral contraceptive pills, or diabetes, then it is candidiasis. And what is actually candidiasis? It is a fungal infection caused by Candida albicans. It's not a sexually transmitted disease, and the signs and symptoms include there's a severe itching, irritation, and white curdy discharge, along with the signs of inflammation, redness, edema, and fissuring, and white curdy discharge is also noticed on examination. Now, how you can remember these signs and symptoms? Well, you can remember it by linking candidiasis to Canada. As Canada is mostly covered in snow, so you can remember the white curdy discharge. And the flag of the Canada has red and a white color too, so redness and soreness along with the white curdy discharge from the flag too. and most people want to move to Canada, so there's a constant itch. And lastly, as whenever someone come from abroad, they always bring chocolates, so you can link the chocolates to diabetes. And as it is a fungal infection, so people move to Canada for fun, fungal fun. Risk factors include pregnancy, diabetic women, immunocompromised women, use of antibiotics, and use of OCPs. So, in short, if you are immunocompromised, then you are more prone to getting vulvovaginal candidiasis. And what are the investigation options? Again, we have a discharge, so we can look it under the microscope, or we can send it for culture and sensitivity. To remember the treatment, you must remember it is a fungal infection, so we have to give antifungal medication. There is a general management, then for the uncomplicated infections, then for the complicated infections, and then if there is a recurrent infection. The general one includes that the high dose OCPs should be changed to low dose, there should be a control of the diabetes, the recurrent use of antibiotics should be avoided. Remember, these three were also the risk factors. For the uncomplicated infection, give topical antifungals and oral antifungal. The oral antifungal is given only as a single dose of 150 mg fluconazole, for example. Then you can give nystatin cream, and if the infection gets infected, you can extend this treatment to 2 weeks. And if there's a recurrent infection, what is the meaning of recurrent infection? It means that if there are at least 4 episodes of infection per year. Then the induction regimen includes 150 mg in 3 doses orally after every 72 hours, followed by the maintenance regimen of 150 mg weekly for 6 months. It is an important question in the past paper and it is repeated several times. So if they mention a curdy white discharge or there is a severe itching, then you should know that they are talking about candidiasis. Now let's focus on trichomoniasis. In the scenario, they will mention the inflammation of the vulva or vagina and a variable discharge or altered discharge. And basically, trichomoniasis is caused by Trichomonas vaginalis. It is usually an asymptomatic disease, but it might show some signs of vulvovaginal inflammation and variable discharge. It is a sexually transmitted disease and it is associated with the following pregnancy outcomes. It can lead to preterm birth, low birth weight, and maternal postpartum sepsis. To remember all these points, break the word trichomoniasis into try come on sis. Come on sis. And she might get angry, that is the inflammation redness. And you are so repeatedly saying come on sis, that even the baby is trying to come out of her earlier as preterm birth, even with a low birth weight. And come on sis will also cause sepsis, okay, maternal postpartum sepsis. Investigations include microscopy, culture and sensitivity, and as you are repeating again and again, come on sis, there's an amplification. So NAT test, that is nucleic acid amplification test, you can do it either on the vaginal swab or on the urine. And the treatment includes metronidazole. Come on sis, try the metro.